Hi, Lynn. My name is Johnny. I'm going to be your physical therapist today. How are you feeling?
I'm feeling great, thanks.
Okay, great. Today we're going to be going over a few stretches for various muscles. I'm going to be teaching you how to do these stretches, so you can do them at home. And for each stretch, I want you to go ahead and hold it for 10 seconds and repeat 10 times on both sides. Okay?
Okay.
All right. So the first muscle that we're going to stretch is called the sternocleidomastoid. Okay? And I want you to go ahead and turn your head that way, okay, and look up. And the sternocleidomastoid is this muscle right here, okay? And I'm going to show you how to do a stretch, okay? You can just stand right there and I'll show you. Basically, you should go ahead and sit, hold your head up high, and you're going to turn your head, you're going to put your hand on top of your head, your right hand on top of your head, all right, and you're going to turn your head this way, and you're going to pull your head down towards your shoulder. Okay, and you should feel a stretch right there on that muscle. You can hold it for 10 seconds and repeat 10 times. Okay, do you understand?
Yes.
Okay, can you repeat the instructions back to me?
Okay. I'm going to turn towards this side and look, and then take my head and hold it down.
That way. And hold it for
10 seconds, 10 times.
Yeah. And do you feel that stretch right there?
Yes.
Okay, very good. Oh, and by the way, I would test the muscle length of the sternocleidomastoid using an inclinometer. Okay, so the next set of muscles that I'm going to be stretching is going to be the upper trapezius, which is right here, and the lower trapezius, which is right here. Okay, so with both the upper trapezius and the lower trapezius, I would be testing muscle length using an inclinometer as well. And the first, why don't you come around here and I'll show you the stretch for the upper trapezius. Okay, it's very similar to the stretch for the sternocleidomastoid, but you're going to take your left hand and you're going to put it behind your back. Okay, you're going to take your right hand, and you're going to hold and put it on the area right in front of your ear. Okay, and you're going to gently and slowly pull your head towards the side, and you should feel a stretch right in the back of your neck, right there. Okay,
Okay.
and you're going to hold it for 10 seconds and repeat 10 times. Okay, do you understand?
Right.
Okay, why don't you go ahead and repeat the instructions back to me?
Okay. I'm going to sit right here, take my left hand, put it behind my back, take the opposite hand over my ear, and turn and hold the stretch for 10 seconds.
Right.
And then do the opposite.
And do the opposite side, yeah.
And hold.
Right, and each side you're going to go ahead and repeat 10 times. Okay, you feel that stretch?
I do.
Okay, great. All right, the second stretch I'm going to show you for the lower trapezius, you're going to sit on the table. Okay, you're going to take your right foot, your right leg, and cross over your left leg and your left foot, cross over your right leg and foot, and you're going to go and hold on to the edge of the table, both hands, and you're going to turn your trunk towards the right side of you. And when you do that, you should feel a stretch right there in the middle of your back. Okay, you're going to hold that. I want you to hold your head up high while you're doing that, and hold it for 10 seconds. Repeat it for 10 times. Okay? Do you understand?
Right.
Okay. Go ahead and repeat that back to me.
Okay. I'm going to sit right here. Take my left leg, put it over the right knee, turn my body, and look up.
Right.
And hold it for 10 seconds.
Hold it for 10 seconds. All right. Repeat 10 times, and then you can go ahead and do it the other side, the opposite side. Perfect. Very good. Okay then, the next test that we're going to be doing is going to be it's called the Thomas test, and basically it's testing two muscle groups. The first one is your iliopsoas muscles, which is also known as your hip flexors, and your rectus femoris muscles, which is part of your quadricep group. Okay, so I want you to go ahead and sit on the edge of the table here. Scoot over a little bit more. Okay, go ahead and put it right here for you. Go ahead and lie back. Okay, and the iliopsoas muscles are right here in the hip area, and the rectus femoris muscle is right here and attaches to the patellar tendon right here. I want you to go ahead and lift up this leg and hold on to it. Okay, keep it Okay, I want you to press down on the table with your thigh and bend your leg as far as you can. Okay, and as you can see, the patient is comfortably resting her thigh on the surface and is bending her knee to approximately 90 degrees, which indicates that she has normal length in her iliopsoas muscle and her rectus femoris muscle. And because both muscles are of normal length and you have normal range of motion, I'm not going to go ahead and prescribe any stretching exercises for you. Okay? And that's it. Thank you. Okay, so the next muscle that we're going to be testing is your gastrocnemius muscle, or your otherwise known as your calf muscle. Okay, I want you to go ahead and lift your leg here, and this is the gastrocnemius muscle right there. Attaches into the Achilles tendon. Okay, go ahead and relax. And the way that we're going to go ahead and test it is I'm going to use a goniometer. Okay, and all right, I'm going to align the fulcrum of the goniometer right at the lateral malleolus, and I'm going to align the proximal arm along the midline of the tibia and the distal arm along the fifth metatarsal right here. Go ahead and bend your ankle upwards as far as you can. Okay. Okay. All right, relax. Okay, so Lynn, according to the goniometer, it's at 10 degrees. The normal range of motion is 20 degrees, so that indicates that you have a little bit of tightness in your calf. And we're going to go ahead and teach you a stretch that you could do at home to increase the flexibility of your calf muscles, okay? Okay, then first I'm going to go ahead and demonstrate to you the stretch for your calf muscle, okay? So you're going to go to like a wall in your house and put both arms against the wall. One leg you're going to go ahead and stretch out, and the back leg you're gonna extend out over here to the back, and keep the heel down on that leg that you're stretching, your right leg. Okay, make sure that the heel is on the floor, right? And then I want you to go ahead and lean forward and shift your weight on the other leg that you're bending. And when you do that, you should feel a nice stretch all along your calf muscles right there. Okay? Can you go ahead and show me that and repeat the instructions there?
I'm going to go like this with my arms out here and then bend and shift.
Oh, make sure that your heel is down, touching the floor. Perfect. And when you do that, do you feel that stretch?
I do.
Okay, great. So you're going to go ahead and do that. Hold that stretch for 10 seconds, and you're going to repeat that 10 times. Okay? Do you have any questions?
No
great.
questions.
Perfect. Thank you. Okay, so the next set of muscles that we're going to be testing is called the tensor fasciae lata and the iliotibial band. Okay, and for that, I'm going to need you to lie on your side. Okay, get your legs up. I'm going to slightly flex the bottom knee and the top upper leg. I'm going to go ask you to bend at the hip and the knee, and I'm going to go ahead and abduct it. Okay, and extend it. Okay, and the tensor fasciae lata is the muscle right here, and the iliotibial band is right here. Okay, I'm going to come back around, and for this muscle, the way that I would test it is to use a goniometer. Okay, and for the goniometer, I'm going to align the fulcrum with the patient's ASIS, which is right there. Okay, and I'm going to align it with the distal arm with the other ASIS. Okay, and the proximal arm is going to be aligned at the midline of the femur using the patella as the reference. Okay, and I'm going to ask that you lower it down. Okay, go ahead and relax. Thank you. All right, so according to the goniometer, your range of motion is at 15 degrees, and the cutoff is 10, which indicates that you have normal length in both your tensor fasciae lata and your iliotibial band muscle. However, I'm still going to show you a nice stretch that you can do at home so that you can increase your flexibility of that muscle, okay? Okay, so I'm going to go ahead and show you the stretch for the tensor fasciae lata and the iliotibial band. Okay, I want you to stand up straight, and you're going to take your left leg and cross it over your right leg. Okay, and you're going to go ahead and stretch down as far as you can go. Try to touch the floor, but it's okay if you can't. And by doing that, you're going to feel the stretch over here on the side of the leg, your right leg. Okay? I want you to go ahead, can you go ahead and repeat that back to me and show me how you would do it?
Okay, I'm going to stand like this, then I'll cross over,
Mm-hmm.
and I'm going to go all the way down.
Right. And do you feel that stretch right there?
I do.
Okay, great. And you're going to go ahead and hold that stretch for 10 seconds and repeat it 10 times. Okay? Okay, thank you.
Thank you.
Okay, so the next muscle that we're going to go ahead and stretch is the pectoralis major, and the pectoralis major is the muscle right there, right in that area. That's your chest area. Okay, and I would basically test the muscle length of the pectoralis major using a tape measure with the patient lying supine with their arms back of their head like that, and I would measure the distance between the olecranon process and the surface of the table. However, I'm just going to go ahead and show you a stretch that you can do at home with either a doorway or a corner. Okay, so why don't you go ahead and turn around, follow me. And if you're going to be doing it at a doorway like this, okay, you're going to go ahead and put both hands and arms as far as you can on the doorway, okay, far up as you can. And at an angle, you're going to stand away from the doorway at a comfortable angle, okay, maybe 40 degrees, but whatever you're comfortable with, okay, and you're going to go ahead and shift your weight forward and press into the doorway, okay, like so, bending your elbows. And when you do that, you're going to go ahead and feel that stretch across your chest, which is your pectoralis major muscle. You're going to hold that for 10 seconds and repeat it 10 times. Okay, do you understand?
Right.
Okay, can you go ahead and repeat that back to me?
I'm going to widen my arms out like this.
Yeah,
At like 40 degrees angle.
Right.
So, and shift my weight forward.
Correct. Okay, and when you do that, do you feel that stretch along your chest?
Yes.
Great, perfect, you're doing great. The next muscles that we are going to stretch are the biceps brachii and the triceps brachii, okay? And for this one, I'm going to have you lie down, supine, okay, close to the edge, all right? And I'm going to go ahead and put a pillow underneath your legs so that you're comfortable. Okay, and this is the biceps brachii muscle right here, okay? And the motion, before I even test it, the motion I'm going to instruct you, okay? Basically, you're going to turn your palms facing towards the floor, okay? And you're going to go ahead and bend your elbow towards your shoulder as far as you can go, okay? And that's the motion, okay? So I'm going to go ahead and do it take a measurement with the goniometer. And with the goniometer, we're going to go ahead and align the fulcrum with the lateral epicondyle of the humerus, which is right there. Okay, we're going to then align the proximal arm at the midline of the humerus and the distal arm with the ulnar styloid process, which is right there. Okay, and all right, I'm going to go ahead and ask you to bend your elbow. Okay. Okay. All right, go ahead and relax. All right, so, perfect. According to the goniometer measurement, you measure at approximately 154 degrees. The normal is 150. So that means that your biceps brachii muscle is within normal limits. Your range of motion is also within normal limits, okay? So the next muscle we're going to go ahead and test is the triceps, okay? And the triceps is in this area right there, Okay? And the way that we test for muscle length of this muscle is we're going to have you flex your shoulder as far as you can. Okay? And then we're going to have you flex your elbow as far as you can. Okay? And are you comfortable? Okay. So as you can see, the patient is able to flex her shoulder and then fully flex her elbow, indicating that she has a normal tricep muscle, normal length tricep muscle, and it's within normal range of motion. Okay. However, you can go ahead and relax. Thank you. However, I'm still going to go ahead and show you how to do a stretch that you can do at home to increase the flexibility of that particular muscle. Okay. Okay. So you sit here, and basically what you're going to do is you're going to take your right hand, okay, and you're going to go ahead and reach it up and down your back. All right, you're going to take your other hand, your left hand, and place it on your elbow, and you're going to pull in the opposite side. All right, and when you do that, make sure you keep your neck straight, and when you do that, you should feel that stretch in that triceps muscle. Okay, and you do that for 10 seconds. Repeat 10 times and do it on both sides. Okay, can you go ahead and repeat that back to me?
All right, I'm going to take my right arm, put it towards my back, and then have the opposite arm and pull it in the other direction.
Right, keep your head up. Okay, you feel that stretch when you pull?
Yes, and then hold it for 10 seconds.
10 seconds,
and
10 times.
Switch.
And you switch on both sides. Very good. You feel that stretch?
Yes.
Perfect. Thank you so much.